Hello, good afternoon, everybody. Thanks for joining us. We are going to get started in just a minute. I see some of our registrants are still logging on and joining us, so I'm going to give folks just another minute or two, and then we'll get started. Hello, everyone. Welcome to today's webinar, Work Requirements Don't Work, What's at Stake and What Can We Do? This is a truly timely discussion, and we are thankful that you're all carving out time to join us today and hear from some really brilliant and wise speakers. My name is Carrie Felton, and I'm a graduate student intern here at Heartland Alliance National Initiatives on Poverty and Economic Opportunity. And before I hand things off to our moderator, Melissa Young, I'm going to touch on a few logistics for today's webinar. So first, everyone who's tuning in today is on mute. So if you have questions or comments, you can use the chat box on the control panel on the side of your screen. We are going to have a Q&A session at the end of the webinar. So if you have questions for our panelists or speakers, please feel free to enter those questions as we go along. My colleague, Caitlin Schnur, will be collecting those throughout the presentation, and we'll field those at the end. So please send your questions in. Also, the slides from today's presentation and a recording of the webinar will be made available on our website afterward. Everyone will get a follow-up email with a link to those. So if you miss a slide or miss something or want to share it with folks later, those will be available. If you're on Twitter, please tweet along with us, follow us as we live tweet the presentation today. We're going to be using the hashtag #WorkRecs-Don't-Work, which is at the bottom of our slide there. We also have a few handouts. On the control panel, there's a tab that says Handouts. There's one from us and a few from the Center for American Progress, and our presenters will be referencing those, but those are for you to download. As mentioned, we've got a really great group of panelists today. Our very own Melissa Young will be moderating, and she will talk a little bit more about who we are and how this conversation about work requirements fits into our mission and vision. We'll then hear from Elizabeth Lower-Basch of Center on Law and Social Policy, and she's going to provide an overview of work requirements, what they are, why they're harmful, how they've played out in the past. and some current and upcoming policy threats to basic assistance programs. What's going on now? What can we expect? Next, we'll hear from Ron Johnson of Heartland Alliance Health, and he's going to flesh out what work requirements look like in action, how they are likely to impact the individuals and families he works with and sees. And finally, Rebecca Vallas of Center for American Progress will give us some tools and strategies for how to talk about work requirements with our constituents, our participants, and within our networks in order to advocate for better policies and solutions. So I think it's going to be a great webinar. But before we hear from them, we want to learn a little bit about you all. So we'll take just a minute to take a couple quick polls. So let me get those going here. Our first question is, which best describes your role? So you should see it pop up there in just a second. And if you wouldn't mind just sharing what best describes your role, that'll help us get a feel for who we have joining us today. Give it just a few more seconds. Okay. So let me share the results. It looks like we have about half from the policy advocacy space, 23% direct service providers, 13% from federal, state, or local government, and 15% other. If you want to chat at us to clarify, then we can kind of share that before our Q&A. Let's see. Next, what are you most interested in learning today? So I'll give you guys a few seconds to let us know what's most important, why you are tuning in today. Okay, just a couple more seconds. All right. So it looks like we've got a good mix of interests here. I can't actually read all of the options from my view, but hopefully you all can see the distribution there.
Okay, great. Caitlin, Carrie, I'm happy to jump in
sure.
Because I can see the results that we have here. So it looks like a lot of folks are interested in hearing about how work requirements are going to impact low-income individuals, as well as how to message effectively about work requirements. Other people at 14% and 18% respectively are looking to hear more about what are work requirements and that overview, and what are the actions that the administration and Congress currently have underway with regard to work requirements.
Wonderful, great. Well, I think the layout we have planned should cover all of these topics, but this information helps us to kind of know where to spend a little bit more time and where to kind of spend a little bit less. So thank you guys so much for sharing. All right. So with that, I'm going to turn things over to Melissa Young. Take it away, Melissa.
All right, go ahead and Carrie and advance to the next slide. First and foremost, before we dig in, just a huge thanks to the team over here for coordinating such a timely conversation about work requirements. We know it's on a lot of folks' minds across the country, and we really appreciate all of you for dialing in today, and especially those folks who are in the snow. So we also want to make sure we thank and our partners both here at Heartland Alliance and our national partners at the Center for Law and Social Policy, the Center for American Progress, the Center for Budget and Policy Priorities, and the Coalition on Human Needs for helping us shape this conversation today and this really important discussion on work requirements. What does it mean? Where is it coming from? What's the rhetoric? What's the whistleblowing? What's going on across the country? So thank you guys so much for joining us and our expert speakers across the country. For those of you who might be tuning in and don't know who Heartland Alliance is, let me just give you a couple of minutes of background. Heartland Alliance is a 130-year-old human rights organization headquartered in Chicago. We provide direct services to individuals living in extreme poverty in 100 communities nationwide and 12 countries internationally. We are committed as an organization to advancing equity and opportunity for all, and through that we leverage our research and evaluation, public policy and advocacy, and systems change departments within the organization to realize lasting change on behalf of the individuals that we serve across the country. Next slide, please. And you can go ahead, flip over to the next slide. This webinar today is being brought to you by our National Center, our national initiatives on poverty and economic opportunity. Our national initiatives here at Heartland Alliance are dedicated to ending chronic unemployment and poverty. Our team is headquartered in Chicago, but we also have staff in DC. Our team leverages program practice, policy, and research to advance change that is informed and grounded in the experience of communities, in providers, and impacted populations across the country. Next slide, please. And as we've already teed up a couple of different times, this conversation could not be more timely or critical given what is already happening in states across the country and at the federal level. As a direct service provider, Heartland Alliance knows firsthand how harmful attaching work requirements to basic assistance programs can be for individuals living in poverty across the country. We also, through our policy and systems work, recognize that, quite frankly, work requirements don't work. The research bears this out over and over again. Moreover, it's important to just flag, and I think our speakers will talk about this today, that the rhetoric, the racist dog whistles, and the myths that surround the promotion and the way that many proponents of work requirements are talking about this policy are particularly concerning, and we should be identifying those and flagging those. So without further ado, I'm going to go ahead and turn the mic and webinar airwaves over to Elizabeth Lower-Basch at CLASP. Elizabeth is the Director of Income and Work Supports at the Center for Law and Social Policy, and her expertise is in federal and state welfare policy, other supports for low-income working families, systems integration, and job quality. And for those of you who may not know Elizabeth, you should. She is on speed dial for me all the time. So go ahead, Elizabeth, take us away.
I apologize, I had muted Elizabeth. There you go, Elizabeth.
Okay, I think you should be able to hear me now. Thank you. So thank you so much, Melissa and Caitlin and everyone for having me on this. It's really great to be here to talk about what's not my favorite subject, but it's a really important one. And I'm getting to provide sort of a 30,000-foot overview of what are work requirements and what do we know about them from the programs where they've been in place. Can you advance the slides, please? Next as well. Okay, so starting, just to make sure that we're all on the same page, a work requirement in this context is a condition of eligibility for a basic needs program. This means that individuals who are subject to the requirement have to work or participate in another qualifying activity for a minimum number of hours per month, or else they can lose their benefits. And depending on the program, people who lose the benefits may not be allowed to re-enroll in the program. And again, depending on the program, particularly in TANF, cash assistance, and sometimes SNAP, family members of the person who fails to meet the requirement can also lose their benefits. So that's really what we're talking about. Next slide. So this is a quick summary of what programs we're talking about. Currently, cash assistance under temporary assistance for needy families, or TANF, has strong work requirements, as does food assistance under the SNAP program. And it actually has two different work requirements that apply to slightly different populations. Housing assistance has work requirements in a few demonstration sites. And Medicaid, you've heard a lot of attention. It does not have any statutory provisions for work requirements, but in the last few months, HHS has granted work requirement waivers to 3 states, with more likely to follow. In addition, as I'll talk about more at the end, there are proposals to expand the work requirements in both SNAP and housing assistance that are being discussed. So that's why we're having this conversation. Next slide. So I think the main thing to understand is that work requirements are based on a stereotype of who receives benefits. It's based on an assumption that people aren't working and need to be forced to work. The reality is that many recipients who can work are already working. And there's really a racialized stereotype. Sometimes people talk about it as a dog whistle that believes that people who are getting benefits need to be forced to work. And this particular slide, I've got data for SNAP, but it's also available for other programs as well, that many people are working. Next slide, please. So as Rebecca will talk about more later, you need to really dig into work requirements, sort of use your decoder ring to explain what they are, because the majority of people sort of intuitively say, yes, those who are able to work should do so. But when you use that decoder ring and explain that what work requirements mean is taking away people's health care and their food and their housing, they're much less responsive. In particular, people understand that taking away people's health care and food doesn't make them more able to work. And that's both intuitively obvious, and there's also research that supports that. Next slide, please. So TANF and SNAP, as I said, are the programs where we've had work requirements for an extended period of time, and therefore where we know the most about their impact. And the big thing to take away is that the biggest effect of work requirements is that it makes it harder for people to access and keep benefits. These are barriers to benefits. Mandatory work programs have little effect on employment or earnings, but they're costly, so they use up the resources that could be used to provide services that would actually make a difference, high quality training and supportive services. Most participants, if they get jobs, continue to work in poverty jobs that offer low pay, unsteady hours, no health coverage, very little opportunities for advancement. And others wind up off of both assistance and not working, essentially destitute. So, next slide. This just shows what happened after TANF, which instituted much stronger work requirements, replaced AFDC. You just see benefit receipt essentially falling off a cliff. And note that this slide is participation among those eligible. So this is not a story about people escaping poverty and not needing assistance. It's about people who are still extremely low income, not receiving it. Next slide. So in the next section, I'm going to talk a bit about who loses benefits. one category is people who can't find work, but it's also workers in jobs who don't have enough or have irregular hours, so they don't hit those thresholds. It's people who are working but can't keep up with the paperwork to document how much they're working, or in some cases, if they submit that paperwork, but the state loses it. We've heard those stories as well. People with disabilities or other medical conditions are disproportionately likely to lose their benefits. And depending on state policies, students and people with caregiving responsibilities can also be affected. I'm going to dig into all of these in a little more detail in the next section. So next slide, please. So people who can't, these are work requirements. If you can't find work, you're likely to lose benefits. In a recession, in a region where there's high unemployment, we know one population that is particularly struggles to find employment is people with previous histories of justice involvement due to discrimination. They can sometimes even find it hard to find a volunteer placement that will take them. And something to emphasize is SNAP and time limits, the time limits under SNAP and the Medicaid waivers that have been approved do not require states to offer some sort of work activity to participants. So people who really would like to be working, are willing to participate, could still lose benefits because they don't have such an opportunity. Next slide. And the next slide just highlights some of the data about unemployment rate by race and educational attainment. And I don't think this data is terribly surprising to anyone on this webinar, but the main point to take away is both people with less than a high school diploma or a high school diploma specifically are far more likely to be unemployed, even in this time of overall low unemployment rates. And even within each educational group, particularly African Americans are more likely to experience unemployment. So these requirements have distinctly disproportionate impact. Next slide. Again, if you're working but not enough hours to meet the requirement, or your hours jump up and down unpredictably and you can't keep up with the paperwork, you could lose your benefits. And that's very common of today's low-wage jobs, which includes seasonal, involuntary part-time, unpredictable scheduling, and particularly, as you see on this slide, women are particularly likely to be in part-time jobs, and Black and Hispanic women in particular. Next slide. So again, these are often better thought of as paperwork requirements rather than work requirements, because even if you're working, you might lose your benefits because you fail to document the hours. And just as an example, Arkansas is one of the states that has a Medicaid waiver. And under that waiver, people have to report their hours online by the 5th of the month after the month ends. So if you don't have access to internet, you're pretty much out of luck. And also if something's blowing up in your life at the start of the month and you miss that deadline, you could also lose your health insurance. Next slide. People with disabilities are specifically at risk of losing their benefits, particularly in Medicaid. A lot of the reporting has said, oh, it only applies to non-disabled people. And the rhetoric around SNAP also says able-bodied. But the reality is that lots of people who have disabilities but aren't qualifying for the programs based on their disability will not be identified. And this is from the Kaiser Family Foundation. And it found that over a third of non-SSI adult Medicaid enrollees who were not working reported that they were not working because of illness or disability. Next slide. So, again, these are promoted as increasing work, and there's very little evidence of that. If you look at this graph, is often what people cite as their basis for why they say work requirements promote work. And this is the increase of single mothers in employment during the late 1990s. But this is a very limited slice. So if we go to the next slide and take away the big blue blocks, what you see is without that selection, you hardly see any trends. Certainly there is an increase, but it begins well before welfare reform. And then after 2000, there's been essentially no trend over the past 15 years. So the idea that welfare reform is increasing work participation is just wrong. Next slide. Similarly, if you look at the SNAP data, there is no evidence that the time limits increase work. And these slides are taken from our colleagues at the Center on Budget and Policy Priorities because they're showing some of the ways that, another way that people who are promoting work requirements lie with data, that they say that there was a huge increase in the share of SNAP participants who are working. And it's true that it went from 21% working to 42% working, but that's because they kicked a whole lot of people off the program, including, as you can see in these numbers, both people who are working as well as people who are not working. So you need to look at the statistics, again, apply the decoder ring. If you see a study and it doesn't make sense and you want some help figuring out if it really says what people says it does, several of us on the call would be happy to chat with you about that. Next slide. This doesn't mean that there are no programs that make a difference in people's lives. There definitely are programs that can increase employment, but they're intensive and higher cost. You don't need to force everyone to participate. Many people desperately want to work and need the opportunity. And so I think one of the things that's most frustrating about these programs, the shift to mandatory programs, is they take funding away from the effective training programs so that you can serve the people who could really benefit from it and actually make a difference. The most effective programs do cost $5,000 to $10,000 per recipient, and they're much smaller scale, but they do pay off in terms of long-term earning gains. Next slide. Most of the proposals that we've seen just sort of wave their hands when it comes to the question of where the funding for work activities is going to come from and assume that the workforce system will be able to provide people with services. But the truth is that the workforce system is woefully underfunded. You can see it's down, funding is down significantly from where it was just a couple of decades ago. And if you look at even longer term trends, even the funding from the 2000 era is significantly diminished. So the workforce system simply does not have the capacity to serve the number of people who would be subject to work requirements in the proposals that we're seeing. Next slide. So I've mostly made this point, but mandatory programs are wasteful. It means that states tend to run low-touch job search programs, not the programs that are more effective. This puts the focus on attendance, literally measuring how much time someone's spending sitting in a chair, not whether the program is getting someone a job. And this is very time intensive. One study of TANF caseworkers found that they spent more than half of their time documenting participation, which is just not useful for anyone. Next slide. So I'm going to just quickly talk about where we're seeing these threats. SNAP, as I said, there are proposals to strengthen the work requirements. Most likely this would happen through the Farm Bill, which is up for reauthorization this year. Just in the past week, we've heard that the House bill was delayed due to strong Democratic opposition to the draft bill that had been prepared by the Republican members of the House Ag Committee, which would have made time limits much more stringent. So they're still negotiating that. In the meantime, there is an opportunity to weigh in FNS, the Food and Nutrition Service, has put out an advance notice of proposed rulemaking seeking input on exactly this topic. Comments are due on April 9th, so I would definitely encourage you to submit comments, and we can share template comments with you. Next slide. On the Medicaid front, the waivers, as we've discussed, are the main center for action. 3 states have been approved. At least 8 more states have submitted waiver requests. More are likely to follow. There is unlikely to be legislative changes in this. The HHS is really pushing this waiver opportunity. Several advocacy organizations have sued CMS over this because this really does push the boundaries and exceed them of what CMS has the authority to allow under waivers. Next slide. And finally, there may be some of this coming up in other ways. Paul Ryan has talked about workforce development, and it did show up as a phrase in the State of the Union message as well. We believe that this is code for, again, restrictions on programs, and it could show up as possibly appropriations riders, especially on housing, or possibly in an infrastructure bill. So that's it. On the next slide, it's got my contact information as well as a link to our website with more information. Thanks so much.
This is Melissa at Heartland Alliance. Thanks so much, Elizabeth, for that great overview. Tons of really, really important information. I know for me, I'm taking away the decoder ring, which I think is a really great visual for understanding the impact and really conversations around work requirements right now. So thanks for that. We're now going to turn our webinar over to Ron Johnson. Ron is a senior mental health worker here at Heartland Alliance Health. He specifically works on our projects assisting transitions for individuals experiencing homelessness. Ron is going to take some of this sort of big picture thinking, big picture understanding of the harms of work requirements, in particular to receiving basic assistance, and talk about it from his perspective in delivering services here in Chicago to individuals experiencing extreme poverty. So Ron, go ahead and take it away, and thank you.
Hey, thank you, everyone. I'm glad to be here and talk about this very important issue. Please move the slide. I'm a senior mental health worker here at Heartland Alliance, where we serve all populations across the board, chronically homeless people, undocumented people, people who are needing health care, people who don't have any health care, people who need benefits. So we do a plethora of things to try to help these populations that we serve. Next slide, please. It's kind of ironic that we're able to come and see these people at this particular thing, because the panelists before me were talking about people who didn't have any benefits or had benefits and get cut off from benefits. And we deal with that on a daily basis, and we see the frustration of the participants when they are homeless, or they're doing other things and they can't get their mail, and they end up coming to see a doctor and they can't see a doctor because their benefits have been cut off. So it's all kind of coming full circle. Next slide, please. So that kind of give you a picture where if we meet a person, this person probably has no ID, no Medicaid, none of these things. So we connect that person, take them to our benefits team, help them get an ID. They have a mental health assessment, and then we try to connect them to a provider or to a behavioral health team or to a medical case management team. And we meet people everywhere throughout the city of Chicago, Lower-Basch Drive, Inglewood, Uptown, wherever there are homeless populations and people in need, we try to help them. Next slide, please. Currently, we're working on a project with a couple, UIC Hospital and Swedish Covenant Hospital, where we're housing their high-end emergency room units. So increasing visits to emergency rooms and kicking people off Medicaid will only increase the number of ER visits because people don't have insurance. They end up going to the emergency room. I think by them losing insurance, they won't be able to find work, and then they will create more barriers that will keep our participants in a position where they will be unable to find work, find a job, or gain steady and reliable employment. And they won't be able to provide the necessary paperwork to prove that they are currently working. Next slide, please. I think there are a lot of people that are undiagnosed, so I think this policy will impact people who have mental illnesses, substance abuse, chronic illness, and that cannot be seen, like many autoimmune disorders and other disabilities that do not qualify under these new requirements. People who cannot work because they care for others are caregivers to family members and children. So it would make a lot of people some residual effects affecting the whole family. Next slide, please. According to New York Times, among adults on Medicaid who don't work and could be subject to the work requirement, 1 1/3 have a chronic health problem or disability, and about half take care of family or go to school, and just under 10% can't find work. In other words, I think a lot of people on Medicaid are currently working, and work requirements will further push these families over the edge and disproportionately affect minorities and other groups. Next slide, please. I think the participants that we serve, these benefits give them dignity. They meet our providers. They are helped to get diagnosed with disease that they don't know they have. It improves the quality of their life. And this slide shows that healthcare saves lives. And homeless people already have a shorter lifespan than other people in the regular economy. And so this slide shows that people who interact with healthcare professionals, this can increase their lives. And I think SNAP and TANF, it helped a lot of our participants during the most vulnerable times of their lives. At least they can have something. And we experience that a lot, where TANF is really, and SNAP benefits are really helping people get back on their feet in a tough time during their life. Next slide, please. I think all in all, Medicaid is working for people who deserve it. And I think healthcare is a human right. I don't think people should have to do anything for it. I think we are all human, and I think we deserve to be treated as such. We are all equal. And at this time, I'll conclude my comments.
Ron, thank you so much. This is Melissa Young back at Heartland Alliance. Really appreciate the grounding of this conversation in the work that you're doing and in the participants and their experiences every day. And so we really appreciate that and your perspective. Last but certainly not least, in our webinar panelists, we're going to go ahead and kick it over to Rebecca Vallas. Rebecca is the Vice President for the Poverty to Prosperity program at the Center for American Progress. Her expertise is in poverty, disability, Social Security, criminal justice, and reentry policy, and a whole slew of other things. At this point in time, I'm going to turn it over to her to talk a little bit more about what we're learning in terms of how to understand how the public understands work requirements, and provide us some tools and resources for moving forward. Go ahead, Rebecca.
Thanks so much, Melissa. Are folks able to hear me?
We are.
Great. I will go ahead. So thanks so much for having me as part of today's wonderful discussion. Obviously, no one's favorite topic, certainly not my favorite topic, but one we all need to be focusing on in this moment of such significant threats facing nearly every program and policy that helps struggling families make ends meet and get ahead. So I'll take my first slide after that. So as Elizabeth mentioned, leaders in Washington, particularly Speaker Ryan, with him President Trump and others, are getting really smart when it comes to how they talk about cutting programs and proposals to cut programs. So we've gotten accustomed over the past couple of years to hearing them talk not about block grants or cuts to funding for programs, but rather in terms of flexibility and streamlining and local control, all things that sound really good at first blush. We've also heard them use framing that is sort of old wine in new bottles. Welfare reform also sounds a heck of a lot better than taking away housing from families who need it to put a roof over their heads. But the latest rebrand that we're now contending with is one that Speaker Ryan seems to have cooked up and which leaked out of the Republican retreats at Greenbrier about a month and change ago. And that new rebrand, as Elizabeth mentioned, is workforce development. We're also hearing variations on this new theme, whether that's promoting work or community engagement, but they're all different code words, as Elizabeth explained, for cutting benefits, making it harder for people to access basic assistance. And in particular, what we understand these new buzzwords to really refer to are work requirements. And so with this evolution of the way Republican leaders are learning to talk about cutting programs and to bring puppies and rainbows language into everything they're saying that's all spelled C-U-T, the task is even more important and urgent for us to be truly leveraging winning messages when it comes to beating back these harmful proposals. I will take my next slide. So here are a couple of examples just in practice of how we're seeing these new buzzwords and this new compassion approach to speaking about cuts to programs like housing and nutrition assistance and Medicaid, what these actually look like when they're used. So on the left, I've got a couple of quotes from Speaker Paul Ryan. Here he is debuting his new workforce development line. It's about helping people. It's not a budget cutting excursive. He also started to use language about the skills gap, closing the skills gap. We've heard him talking about getting people the skills and the opportunity to get into the workforce. And some of this is now having an impression on some other leading Republicans in Washington. It seems that Speaker Ryan is trying to help them evolve their language in the way that he has in an effort to try to sell these types of proposals. And so we're hearing from leading Republicans in the House, such as the chair of the House Republican Study Committee. There's Mark Walker talking about how, well, we've got to get the framing and the phrasing right, but wouldn't you want to see someone who's struggling excel? We've also now notably seen Seema Verma, who is the administrator of the Centers on Medicaid and Medicare Services, and who therefore is the architect and one of the lead talkers about the Medicaid work requirements, now starting to pepper the states, with 3 states approved to take away health care from people who can't find work or get enough hours at their job. She's been talking in terms like we saw in an op-ed she wrote in the Washington Post just a few weeks back about how we're trying to make programs like Medicaid into pathways out of poverty. True compassion, trying to help people achieve the dignity and self-sufficiency they deserve. So with all of these as sort of examples of what we're up against, we at the Center for American Progress have spent the last year and a couple of months doing extensive message testing, focus groups, and polling out there in the field to try to isolate and hone effective messages to beat back these types of incredibly deceptive but really good sounding messages that we're seeing on the other side. So I'll take my next slide. For any of the nerds out there who want to see some of the specific methodology behind what we've done between 2017 and 2018, here are some more descriptions and details of the focus groups, where we did them, the online qualitative boards that built on those focus groups, and then the initial survey that we did last year. We built on all of that with a poll that we put in the field not too long after the tax law was signed into law at the end of last year, and as it began to take effect in early January. And that was a nationally representative survey with oversamples of African American registered voters, as well as Latino voters and millennial voters. And so all the nerd stuff is right there, plenty more where that came from, but without further ado, I'll get into some of our findings and key takeaways. Next slide. So our key findings coming out of this message research, as well as this most recent poll, are that it's not just Medicare and Social Security that are the third rails of American politics. Americans overwhelmingly oppose cutting programs like Medicaid, like nutrition assistance, like housing, like Social Security disability benefits. And this opposition to these types of cuts doesn't just exist among progressives and Democrats. It spans into independents as well as into Republicans. Even Trump voters don't want to see these types of programs cut. I'm going to go into much greater detail about our specific findings, but I will note specifically that there is also opposition, majority opposition, to work requirements when people understand the consequences. And I'll get into that in particular in just a couple of slides. But I'll also note that it's not just opposition to cuts that we found. We also found that there are real political consequences to backing these types of cuts. And in fact, a majority of voters are less likely to support a candidate who backs cuts. I'm going to go through a couple of our other findings as well, but just to tease one of the most interesting pieces that we found in this work, this support is not just intellectual or abstract for these programs. People understand that they're there for them. And a big part of that is because of the economy really no longer working for a majority of Americans. People now understand, not just in times of recession, that these programs are there for them when wages aren't enough or when they're not able to find work. We also found real connections between views on the tax plan and benefit cuts. I'll get into that as well. And then lastly, we also found updated numbers reflecting the widespread support for a whole range of progressive policies that would actually cut poverty and expand opportunity, by contrast to the cuts that we're seeing Speaker Ryan and President Trump embrace. So with that, I'll get into some of the numbers, and I'll take my next slide. So here are some of the specific findings that we found in this polling in terms of opposition to cutting Medicaid, Social Security disability benefits, home heating assistance in the form of LIHEAP, unemployment insurance, Head Start, affordable housing. You see the full length of these bars reflects, for example, the top bar there is Medicaid. 80% of Americans oppose cutting Medicaid. You just don't see numbers like this. In fact, our pollsters' jaws were almost permanently stapled to the floor when they were seeing these numbers come back. Incredibly widespread opposition to these kinds of cuts. Next slide. And this shows a whole range of other programs. 2/3 of Americans oppose cutting nutrition assistance through SNAP, widespread opposition to cutting healthcare subsidies under the Affordable Care Act. And now let me get into the work requirements piece of this, because this was one of our most important and most timely findings. Next slide. Oh, I'm getting ahead of myself. I'll go to work requirements in a minute. So I mentioned that we found connections between the tax plan and the views when it comes to proposals to cut benefits. And what we found was, while there's this tremendous widespread opposition to cutting Medicaid and nutrition and housing and more, that opposition only becomes more intense when people understand that it's to pay for tax cuts for the wealthy and corporations. And in fact, before you even have that conversation with someone and educate them about the connection between these two discussions, which are often framed as separate, people understand that the cuts that are being proposed to Medicaid and nutrition and housing and more are indeed to pay for tax cuts for the wealthy and corporations that have now gone into effect. And that's something that the public already understands and sees that connection between. Perhaps that shouldn't be a surprise, considering that Speaker Ryan, President Trump, Mitch McConnell spent the better part of 2017 trying to take away health care from tens of millions of Americans, all to pay for tax cuts for the wealthy and corporations. And then they weren't able to do the first piece because of its tremendous unpopularity, but they went ahead and skipped to step 2 and passed those tax cuts for the wealthy and corporations. People understand the connection, having watched that play out all last year. Next slide also has a little more detail on this point. So again, showing that opposition to the tax plan, but also the opposition to these benefit cuts, only gets dialed up further when you demonstrate that connection between the two. I'll move on to my next slide. Here we have a little bit more on the numbers in terms of the political consequences of backing these cuts. Here you see the specific breakdowns program by program, showing the a degree to which people are less likely to vote for a candidate who backs cuts to these individual programs. Next slide. So now I'm going to dig into work requirements in particular, as I teed up before. So while some polls have been covered in the media as reflecting supposed widespread support for work requirement policies, what we ended up doing in this poll, we were curious to dig in a little bit more deeply and ask, is this really about support for these policies, for taking away health insurance and food and housing from people who can't find work or navigate new bureaucracies and paperwork? Or is it that the phrase itself, work requirements, has actually become a loaded phrase and one that itself is pushing support that would not be reflected if people understood the consequences? So what we did in this poll was to ask the question, okay, do you support allowing states to deny Medicaid to people who don't have a job with a certain number of hours and who aren't currently participating in a government-approved training program? And we found that when you ask the question in that way, and therefore people are confronted with the consequences of this policy, boom, majority opposition, support for that policy evaporates. And then we did this as a split sample, asking two versions of the question. We decided, what if we dial it up just a little bit and throw just an ounce of advocacy into that question? So what about allowing states to deny Medicaid to people who can't find a job with a certain number of hours and aren't currently working and can't find a job with a certain number of hours? And when you dial it up even just a little bit, what you find is, boom, more than 6 in 10 opposition to this policy. So our conclusion and our pollsters' takeaway from the way that we dug into this particular issue is that while there may at first blush be support when people are confronted with framing that has become itself a loaded frame that we've seen proponents of work requirements use for so long, and that frame can be as simple as using the phrase work requirements itself, that might result in some level of support for the policy, but that when people understand the consequences, they don't want to see people lose their health insurance or their food or their housing for that matter, just because they can't find work or get enough hours in their job. So that was a really key takeaway for us from this poll. I'll take my next slide. So here, this pulls from some of the focus groups and the message testing that we did last year. We were looking for, is there a message that would beat that Paul Ryan dependency message that we're now seeing to continue to get refined and honed with extra puppies and extra rainbows? And what we did is we tested a model of a message that both helps people understand the consequences of the policy, but also did something that our message testing gurus refer to as oppose and propose. We helped people understand the harmful consequences of the policy, and then we pivoted to something that is an alternative that would actually help people. And so here is the message that we found that beats the Paul Ryan dependency message by 20 points. And that's that cutting off people's basic living standards by taking away their health care, their housing, in this case it was disability support, it could also be their food, only makes it harder for them to get back on their feet. Rather than punishing people who are already struggling, we should be helping to create jobs and boosting wages. That message, and you can vary it however works for you by inserting other policies that are the ones that you're fighting for in that oppose and propose model, that particular message beats the Paul Ryan dependency message by 20 points. Next slide. So here is the set of findings that I mentioned up top were so interesting to us because they reflect not just the support levels and the opposition to cuts that we see and the political consequences that I mentioned, but the why behind why people care about these programs and don't want to see them cut. And what we found in this poll is that 70% of Americans within the last year have experienced significant economic hardship, either themselves personally or a family member in their immediate family, 70%. And of course, we're not living in what economists would tell us is a recession at this point in time. So a 70% figure when it comes to these types of experiences just in the past year is really pretty mind-blowing when you think about how widespread economic hardship is, and that it's an us, not a them, in this economy that's only working for the wealthy few. And so what we found specifically, and I'll move through these next several slides extremely quickly just to give you guys some of the individual numbers, but we found that nearly half of people have been directly affected by not being able to find a job with good wages in the past year, or a family member. Next slide. We found that 40% of Americans have had a serious problem with affording needed medical care, or someone in their family has. Next slide. Similar figures when it comes to having a serious problem with putting food on the table and struggling with food insecurity. Next slide. Similar figures again, nearly a third of Americans struggling to afford their rent or their mortgage. Those are figures that are consistent with an affordable housing crisis, yet of course we're seeing proposals to take away all of these types of supports despite these figures. Next slide. And then because of people really understanding that these programs are there for them, that these are problems that they themselves have faced, or that someone close to them has faced even just within the last year, it ends up not being a surprise that we end up seeing figures like are demonstrated in this particular slide. We found that 3-to-1 people agree with this statement that even if I may not need them now, I'm glad that we provide services and supports to make sure people can afford the basics when times get tough. That statement is one people picked 3-to-1 over the alternative that I don't really ever see myself being in a position where I would need or want to use healthcare, nutrition, housing, or income support that's offered by the government. People see themselves in these programs, and that's particularly important because people see themselves in this fight. Next slide. I also mentioned that the policies that Americans overwhelmingly and across party lines do want to see, in contrast with policies to take away food and housing and healthcare and disability benefits from people who need them when times get tough, these are the policies people do want to see, whether it's huge investments in job creating infrastructure projects, meaningful investments like those that would actually translate into job creation, whether it's paid leave, whether it's raising wages, whether it's universal pre-K, all of these policies pull off the charts, and the support is true across party lines. Next slide. A few more of those policy solutions as well. I'm going to keep moving pretty quickly because I'm running low on time. So those were the key takeaways from our message testing and our polling. Just reiterating those in this slide. Again, I will keep moving to the next slide. So the key takeaways from our message research in particular, I just wanted to hit on as some tips as we think about what are the ways to message about these programs that resonate with people and that help them understand what's at stake. One of our first key takeaways was that we need, wherever possible, to be avoiding pity and charity framing rather than the most vulnerable among us or the poorest of the poorest, framing such as you and your family, and proposals are going to take away healthcare and housing and nutrition from you, from your community. Talking directly to people is something that works much more effectively than talking about them. That sounds common sense, but really was borne out in spades in our focus groups and other components of that message testing. Similarly, we found that safety net is a term that people generally just don't understand or resonate with. It's not something that they view as for them if they even know what it is. But a term that really did resonate was basic living standards, the basics. That's something that people say, oh, that's me, that's my family, that's putting food on the table and a roof over our heads. That's a term that people see as about us as opposed to about them. And then similarly, we found, again, sort of common sense, but borne out by this testing, that we are doing our best and we're resonating the most when we avoid jargon and acronyms, and with some exceptions, program names. So rather than using something like SNAP or WIC, talking about programs that help families put food on the table, programs that help families keep a roof over their heads. Some of the exceptions are Medicaid, Social Security, and Medicare. Those programs have extremely high recognition, name recognition, as does Meals on Wheels, but with generally those exceptions, talking about the purposes that the programs serve has much higher resonance. Next slide. We also found that naming your villain and highlighting trade-offs is an incredibly effective messaging tactic. So whether that's marrying the contrast of slashing affordable housing to pay for tax cuts for the wealthy and corporations, that's the way to really dial up the maximum opposition and resonance. We found that disability is an especially powerful lens. So highlighting the impact on people with disabilities is something that's important to do, not just because they are one of the populations who's going to be hardest hit by some of the policies we've been talking about today, but also because it helps people understand the consequences in a way that makes it very real. It spurred some of the greatest outrage that we saw among Trump voters in our focus groups. And then finally, I mentioned oppose and propose, but we found that this is true across the board. We are connecting with people and resonating with them the most effectively when we aren't just opposing the policies that we know would increase poverty and decrease opportunity, but when we're also contrasting them with the policies that we know will cut poverty and expand opportunity by contrast. And that's particularly important, as I mentioned, when it comes to beating that dependency message on work requirements. Next slide. So in practice, one of the most powerful pivots that we have for that oppose and propose comes in the form of raising the minimum wage. Now, one of the things that you never hear Speaker Ryan or President Trump talk about is how the minimum wage, the federal minimum wage, has stayed stuck at $7.25 an hour, and that is one of the major drivers of poverty in this country. And yet, their proposals are to take away healthcare and food and housing in ways that aren't going to help anyone find work any faster or put food on the table to be able to support their family just through wages. So one of our most powerful message pairings that we found, and I've got it here on this slide paired with some new analysis that the Center for American Progress just put out a couple of weeks back, is really centered on the minimum wage. So I'll put this into practice here. What we found in that analysis was that because the minimum wage has stayed stuck at that $7.25 an hour poverty wage level for nearly a decade, a minimum wage worker today has to work an extra 2 months just to earn the same in take-home pay in real terms that she did in a year the last time the minimum wage was raised in 2009. Now, as a result, that minimum wage worker takes a huge pay cut this year, nearly $2,370 in lost purchasing power this year alone. I note on this slide that that's more than 47 times the average tax cut that the same worker can expect under the tax law that took effect earlier this year. And so here we've paired these messages. Taking away someone's health care or food or housing isn't going to help them find work any faster. If Trump and Ryan were serious about helping the forgotten man and forgotten woman, they would raise the poverty level minimum wage. So boom, we've done that oppose and propose pivot and taken us to a place where, hey, if Trump and Ryan were serious about shrinking these programs that they say they want to see savings in, they would raise the minimum wage because that would save raising the minimum wage, in fact, just to $12 would save $53 billion in SNAP over a decade because fewer low-wage workers would need help feeding their families. So there you have in practice some of that oppose and propose with some of our recent analysis. Next slide, and then I'm going to close in about a minute. So I've got a little bit of information on the next couple of slides about a campaign that brings together a whole range of organizations who are working to stop these cuts. It's called the Hands Off campaign, and it brings together groups like Indivisible and Move On alongside some traditional anti-poverty allies as well as labor, a whole range of groups. And the goal of this campaign is about putting a face on programs that are in the crosshairs and showing policymakers that supporting these kinds of cuts will have political consequences, as that polling found. So you can find out more about the campaign at handsoff.org. You can also use the hashtag or follow the hashtag on Twitter, handsoff, for ongoing conversation and storytelling around these issues. Next slide, and I'll just move through these just for information, and then I'll close. We also have data toolkits at handsoff.org showing by congressional district and state numbers of people who are at risk of cuts in these different areas. Next slide. I'll keep moving through these slides. We've been working with storytellers. There's a picture of one with Nancy Pelosi. Her name is Kendra Tappan. Next slide. Marta Connor there with her daughter Caroline, another storyteller. Next slide. One of the ways people have been doing storytelling with Twitter is sharing stories with these kinds of cards and using the hashtag handsoff Meals on Wheels to pay for tax breaks for millionaires, something you can tweet easily using your cell phone. Next slide. And there's my contact information. Thank you so much.
Thank you so much, Rebecca. Wowza, that was a ton of great information, and I'm sure we have all kinds of questions flowing in. At this point in time, if you have a question for any of our speakers or all of our speakers, just make sure you're logging it in your chat box on the right of your screen. And at this point in time, I'm going to turn it over to my colleague, Katie, to start teeing up some of the questions that we've gotten throughout the presentation today. Katie?
Great, thanks so much, Melissa. We have gotten a lot of questions. I'm going to try to get through as many as I can. For those questions that we don't get to, after the webinar, will connect folks to a panelist who can hopefully answer that question. All right, so I am just going to dive right in here. Elizabeth, this first question is for you, pretty straightforward one in terms of advocacy. The question is, will the template SNAP comments be available as a handout from class?
Absolutely. We're happy to share them, and I think hopefully we'll be able to email them to everyone who's registered for this webinar. And if you don't get them, feel free to reach out directly to me.
Great, thank you. I will send this other one to you as well, which is, can you talk, we know that some states have filed lawsuits around these Medicaid waivers. Do you have any updates on the status of these lawsuits?
Right, so there's a big lawsuit that Kentucky Equal Justice, the National Health Law Project, and the Southern Poverty Law Center filed on behalf of 15 people in Kentucky who are at risk of losing their health care because of the waiver. That lawsuit has just gotten started. As those of you who've done lawsuits know, they tend to take a while. One of the shocking things that's happened is that Governor Bevin of Kentucky, who is not named in the lawsuit is against the Center for Medicaid and Medicare Services for issuing the waiver. But Governor Bevin has countersued the plaintiffs, which is clearly an attempt to intimidate low-income people from taking action. So it's kind of horrifying. There's likely to also be lawsuits filed in the other states as the waivers are approved, but those are in process or not yet filed.
Great, thank you. This next question, I am going to ask or direct towards Ron, which is, Ron, could you tell us if you've worked with McKinney-Vento homeless education within Chicago Public Schools, and tell us what that work looked like?
Well, the last time I worked with Chicago Public Schools, it was we helped assess 100 families to be put into a pilot program, and the money was coming from the shared tax coming from the people who rent their homes out on those apps, and so we went in and assessed 100 families which were then handed off to a housing case manager. And they found them housing. Well, it looked tough because you had families that were in blighted communities, and they were homeless, and their kids were still coming to school. And so for me, having 2 kids in Chicago public schools, I couldn't imagine if we were sleeping in the car, you know. And so just tried to serve those families with compassion. And at the last meeting I went to before we closed it out, I think about 90% of those families were housed in some low-income housing instrument that was provided through HUD.
That is actually a good lead-in to another question that came in. And Elizabeth, I might direct this towards you. Rebecca, feel free to weigh in as well, Ron, or anyone else. The question is, I'm worried about how Housing and Urban Development, or HUD, might add work requirements to housing assistance, especially for people who have addictions or disabilities. What are current threats and how likely are they?
Sure. So a handful of housing authorities do have work requirements currently. There's a authority for essentially waivers that Congress provided a couple of years ago. We've heard rumors, and it's in the president's budget proposals, that they'd like to really expand this to many more housing authorities and throughout the program. But I don't have any more details than that. I don't know if others do.
Anyone else want to weigh in on that, or there are many other questions I can go to?
This is I think the only other thing I would add, which was covered in the presentations, but I think is a really important point for folks to just take away, is that while many proponents of work requirements claim that people with disabilities are protected under these policies, they in fact are not, as was discussed at length by both Elizabeth and Ron. And that's a really important point that we need to be helping people understand, that these policies have been written in a way that people with disabilities and people with mental health impairments are some of the folks who are most at risk of losing health care, losing housing, losing food. And that's something that we need to make sure that we're communicating as we talk about who's at risk in these policies.
Great, thank you. Rebecca, we do have a lot of questions that came in around your polling data, so I'll pitch a few out right now. One of them is, do you have suggestions for messaging on how work requirements would impact people who are formerly incarcerated and have a criminal record that can be a barrier to meeting work requirements, as Elizabeth mentioned?
We do not have any specific messaging on how to communicate around that particular population's risk in this type of policy proposal. It is something that we at CAP think is really important to be weaving into all of our communications about who's at risk of losing basic benefits under these proposals. But I think that generally just messaging around people who are having trouble finding work or who face barriers to work, and that's going to be one of the groups of folks who is most impacted and most hurt by these types of policies, is something that we need to be doing. And I think generally just drawing from what we know messages effectively in the criminal justice reform space and in second chance policies specifically, that just a little bit of work to set up who people with records are can make a lot of difference, and in particular putting a face on the story so that it's not just in the abstract can also be helpful. So helping people understand that 1 in 3 Americans has some type of criminal record, that most of those records are actually extremely minor, and many are actually just arrests that never even led to a conviction, but that nonetheless, having even a minor record can be often a life sentence to poverty, because someone is going to have tremendous difficulty finding a decent job that pays decent wages, if any job. That sort of education up front can help people understand that then it's about kicking people while they're down and trying to get back on their feet in a way that will actually inhibit successful reentry and result in people potentially being at risk of going right back to behind bars, where they're doing everything right now trying to turn their life back around, would be incredibly counterproductive and would run counter to the bipartisan support that we'd like to continue to see for criminal justice reform and for second chances. That's not a soundbite, obviously. It's a lot of work to sort of get there, but it's a marriage or an attempt to marry some of what we know messages well in those two different spaces, and it is obviously a nuanced issue. If there are folks who want to get in touch on that specific point, I'd be happy to think a little bit more specifically with folks about what could work.
Great. And I'll pitch on another question to you around some of this messaging research, which is, did the argument of increased administrative costs resonate with focus group members? Ideas like more red tape, bureaucracy, et cetera, perhaps specifically with Republican voters?
It's a terrific question. It's not something that we looked at in our particular poll or in our focus groups at that level of detail or with those specific arguments. However, Community Catalyst, one of our partners and a partner of everyone who's on today's webinar, has actually just done some really helpful focus group work digging into those exact specific types of arguments. And I would refer folks to the findings that Community Catalyst just started to release yesterday in a briefing that they did that now is being disseminated more widely. So those are materials that I would direct folks to see how those particular arguments did. Some do work. It's a little bit more nuanced than we probably have time to get into today, but they have a lot of really rich information about the paperwork arguments and which work and how.
Great, thank you. This is a question, I suppose, Elizabeth, I will direct to you first, but others, please feel free to weigh in. The question is, can you talk about how transgender individuals could be impacted by work requirements when they face some of the most daunting discrimination in hiring and in the workplace?
Yeah. So I think it's true that, first of all, that any population that faces hiring discrimination or volunteering discrimination is going to be disproportionately impacted. I also think it's important to recognize, that there's already very high rates of poverty in this population, and that access to healthcare can be particularly urgent. So it's definitely a challenge. I have not seen certainly any of the, state waiver proposals in Medicaid address this issue.
Okay, thank you, Elizabeth. Another population specific question that came in, and Ron and Elizabeth, I'll ask that you both weigh in on this. So it starts with a comment. One thing I haven't heard mentioned is how this, meaning expanded work requirements, will impact families with children, specifically children under 5 who are not school aged, and with families that have childcare expenses that put them over the edge with bills. Childcare help isn't going to be enough to help families work because they don't pay enough of the childcare to really help, so childcare subsidies. Also, some children may be more medically fragile, and child care centers could be detrimental to their health. So I think I would be interested, Ron, to hear from you. You mentioned that you've done some work with families, and if you could just talk about the impact you've seen on families with children who have lost access to basic assistance, such as healthcare. What happens next for those families? What can they do? And then Elizabeth, if you could talk a little bit about how work requirements might impact families that have young children.
Okay. Well, we have done some work around some of the city of Chicago shelters that's funded by the city of Chicago. And by me working in the schools, I did come across some young ladies that were under 24 and did have kids and did lose health benefits because of auto-enrolling with the new managed care program. We were able to direct them to get their redetermination done and get their kids up and moving. But it kind of looks like this. A small child has asthma, runs out of the asthma pump. The mother goes to the doctor. The doctor say, oh, your medication, your recipient ID number is not working. That child has to then go to a federally qualified health center that will give that medication free. It's kind of very hard to navigate if you don't know the system. But on the other hand, I saw some very resilient young girls at some shelters who were subsequently housed, and they found access to daycare, and they were working part-time jobs because they wanted to work. And so that it encouraged me, and it pushed the stereotype back that these young people are looking for solutions, and they are very resilient. And so they're just a pleasure to work with. But they do run into trouble. And the most of the times that what we try to do is just educate them and to make sure that they can look out for those redeterminations and things like that.
Thanks. And Elizabeth, can you add anything about how current work requirement threats could impact families with young children?
Sure. So many TANF families do have young children, and often in TANF, parents are subject to the work requirements with children as young as 3 months. So access to quality childcare is a huge problem, and also access to childcare during the hours that people are able to find jobs. Because just as we talked about before, low-wage jobs often have unpredictable variable hours, and it's often very difficult to obtain childcare that lines up with those hours. So yes, is a huge challenge for families and really has effects on children's development and well-being. We have not had that conversation as much in the other programs. SNAP, the primary requirement that has been in discussion, the time limit, currently only applies to families without children, although we are hearing that the House Farm Bill proposal would expand it to some parents, mostly parents of older children, but it's still concerning. And some of the Medicaid waivers, the proposals are in states that haven't expanded Medicaid, which means that the only people who are affected are parents of low children and very low income children. Particularly, Alabama has one of the lowest Medicaid eligibility rates in the country, or income coverage in the country. So, yeah.
Okay, thank you. And in our last few minutes of Q&A, I'm going to put out a question that kind of pivots from the work requirements discussion to solutions. Melissa, I would direct this to you kind of primarily. Others, please feel free to weigh in. Rebecca, you touched on some of these other solutions in your slides as well. The question is, I would be interested to hear about alternatives to work requirements. What initiatives do studies show to actually be effective in increasing employment?
Sure. I mean, that's a great question. And I really encourage all of the panelists to weigh in on this. I mean, I think that, one of the things that we've talked about today is really sort of anchoring conversations around job creation, wages, and we saw through some of Rebecca's polling data that really there's a lot of interest in large-scale infrastructure development and other things. I think from our perspective at Heartland Alliance, we understand all of this work as being critically important when we also think about quality on-ramps into infrastructure jobs, when we think about programs like subsidized employment programs, transitional jobs programs that really do and are intended to meet people where they're at in terms of their interest in wanting to work, as well as the supports and services necessary to wrap around individuals and support them in being successful in work. So certainly, from our perspective, this is a really important piece of the puzzle as we talk about the kinds of solutions that we certainly need more of across the country. Others on the line?
Sure. This is Elizabeth. In addition to that, so the macro level solutions, which Rebecca talked about, I really do think connecting people to real jobs, whether it's subsidized or unsubsidized jobs, I think the woman in one of the pictures on my slides who was holding up the shirt saying, "I need a job," was pushing because there had been a subsidized job during the program during the recession. Heartland actually helped run the program in Illinois, and people were literally lining up at 4 a.m. for the opportunity to participate. So I think recognizing that people really want the opportunity to work, and also that we know that the training programs that make most sense and are most effective are ones that are actually tied to what employers say they need and the skills that they're hiring. And that's a much more intensive and, in some cases, time-consuming approach, but it makes a difference.
Great, thank you both so much. With that, in the last few minutes we have, I'm going to kick it back to Carrie, who will just walk us through our final slides. Thanks, everyone. Also, I would say we did get a lot of questions that we didn't have time to answer, and I will do my best to connect questioners and panelists. Thank you.
All right. This was such a wonderful webinar. Thanks to all of our panelists. Thanks to Katie and Melissa. The webinar recording and slides will be available on our website. Everyone who registered for the webinar will get a follow-up email with a link to the slides and the recording. I'll also try to include some of links to some of the resources that we talked about today from CAP and CLASP. And we also have other free toolkits on our website. And here's a slide with contact information. And I think all of our panelists said you're welcome to reach out with any follow-up questions. Please stay in touch with us as this conversation is ongoing. And have a great day. Thanks, everyone.